approach in the way we do the surgeries.
So it's always the best mode of getting the surgery done.
Not always. I think no matter how much we are advancing in our techniques or knowledge, that always we should tailor the treatment individually.
This is also a purpose of having this podcast channel, is getting experts and talking about medical stuff, rather than, there are so many non-medicals who are talking about medical stuff online, on internet, everywhere, on all social media platforms, which is creating a bit of unrealistic, I would say, a picture or image of the disease and prevention and so much of stuff. But then coming from the expert is what really matters. You cannot just, anybody can come out and start talking about this is how the disease happens, this is how you can prevent it. It has to come from the expert. That's what takes you way long in the experience. And that's what makes doctors different, when they talk about something.
Appreciate you raise this one here because on channels, YouTubes and whatever, you see a lot of people talking, a lot of them, but they are not. Appreciate that you devote your time for the sake of patient education and talking to experts.
Thank you. And thanks to you, like people like you who are supporting me to fulfill this, this small initiative to help the community getting the right information. And, there's a lot to go. It's a I would say a long journey.
Back to your question, you told me that laparoscopy, for example, is it good for all? No. We should not forget there is another way of surgery. It's called open classic surgery. We tend to forget this kind of thing. I don't know how to, on which wall I have to bang my head, and sometimes I said, excuse me, please call me. I don't have time. And you spend sometimes 3-4 hours negotiating with them. And then I say, I'm sorry, I can't teach you medicine online. So, but that's the problem. I can't solve it. Hospital cannot solve it. This should come from government. This should come from centers. That to make it easier. Make it easier. I know there's the other side of the coin. Some people might abuse the system if they agree for everything. But if they know, okay, there is a name, okay, it's Dr. Anita, we know her for, I don't know, whatever, we give value to this and we trust. We monitor them. So if something wrong, then you deal with it. But you don't assume from the beginning that you're up to no good.
And you make everyone suffer. Your patient suffering, doctor suffering, right? Welcome to Med Talks by Dr. Anita. Today we are honored to present Dr. Godratullah Nowrasteh, an internationally acclaimed consultant general surgeon whose unparalleled mastery spans over 2 decades across Hungary and UAE and beyond. With more than 20 years of distinguished service in UAE, Dr. Godratullah stands as a pillar of surgical excellence, renowned for his dual European board qualification in surgical oncology and breast surgery, as well as his esteemed fellowship of the American College of Surgeons and Surgeons of Excellence accreditation in minimally invasive surgery. Dr. Godratullah's dedication to his craft is matched only by his drive to stay at the forefront of medical advancement. His impressive hands-on skills, including advanced laparoscopic, double-handed, and minimal invasive techniques, enable him to perform complex surgeries with precision and poise. He has devoted his career to mastering a range of challenging procedures spanning breast and thyroid surgeries, colorectal interventions, and soft tissue tumor removals, all with a deep commitment to patient-centered care. Beyond the operating room, Dr. Godratullah is shaping the future of surgery as the program head of DHA Medical Internship and Residency Program Director of General Surgery at Medcare Hospital. He is also an adjunct professor at the University of Sharjah, where he leads cutting-edge laparoscopic and surgical courses. Imparting his advanced techniques to the next generation of surgeons, his relentless pursuit of knowledge is evidenced by his extensive continued education, including workshops on robotic surgery, complex hernia repair, and abdominal wall surgeries and reconstruction. With numerous accolades for his contribution to surgical innovation and education, Dr. Godratullah is not only a master of his field, but an inspirational leader dedicated to advancing medical excellence worldwide. Join us as he shares his expertise in surgical innovation, preventive care, most important, and the nuances of treating complex cases, providing valuable insights for both medical professionals and the general public. Dr. Godratullah, thank you so much for coming on my show, Med Talks by Dr. Anita. I'm so obliged. You took out some time from your busy schedule to come here.
No, thank you so much. I'm very glad and honored, and I appreciate this opportunity.
Thank you. Really, it's a Sunday, and you directly landed from your OPD, to come to the show. So, I'm honored.
No,
Thank you once again.
Honor is mine, and yeah, definitely. I was working, but I was waiting for this moment so we can catch up and have it some.
Absolutely.
Talk, yeah.
Yes, absolutely. Thank you so much once again. I'm sure time flies, like almost many years now, right? It's 6 years, 5-6 years we know each other, right? But then at least by this platform, we keep meeting. And I'll keep calling you as well, because one podcast I'm sure is not enough to cover your extensive experience in your field.
Yeah, first time I met, it was, I think, way before the COVID time. Right?
Yes.
Yeah. So, but I'm glad that time has passed.
Time has
Anyway,
passed. Yes, it was. So, Dr. Godratullah, in short, like I want to ask, that's always my opening statement. What made you choose minimal invasive surgery or laparoscopic surgery, to be specific?
You see, we're talking about a progression of certain things in life.
Right.
Minimal invasive surgery is not a choice; it's a must. So to stay on the edge, and also there is no other way. We can't live as a surgeon without minimal invasive surgery, because that's how we can ultimately help our patient to the best. That's it. So it's not a choice.
It's a must.
It's a must.
Wonderful. So what differentiates general surgeons who is not, like, what exactly is minimal invasive surgery for our audience to understand?
It's a very good question, because it's a big topic, definitely. So it's say minimal invasive surgery. Let me correct this. Minimal invasive surgery indicates the approach, a new approach in the way we do the surgeries. What it means that, let's say if you take an example or let's say we do a laparotomy. Earlier we used to open the abdomen, let's say, 25, 30, 40 centimeter cuts. Talking about big cuts. These cuts are minimized now. So we don't need to open an abdomen to go inside, see what's happening. By using small cuts, using right tube, we call it ports, and with the help of imaging technique, then we can, without traumatizing the patient or the minimal trauma, minimally invasive, we can solve the issues.
Right.
What is the benefit for this? It's easy. So less cut, smaller cut, it means better scar.
Easy
it
recovery.
Means easy recovery. It means less complication. It means less pain, and above all, less time of stay in hospital for the patient, so patient can go back to their normal everyday life, back to the family as soon as possible. So
it's always the best mode of getting the surgery done, right?
Not always. I think no matter how much we are advancing in our techniques or knowledge, that always we should tailor the treatment individually. This is so we don't have one size fitting everyone.
Right.
Of course, if we go back from the beginning until now, there has been a lot of contraindications have changed to relative contraindication, and a lot of contraindication, and they are not contraindication anymore when it comes to choosing the minimally invasive treatment.
Right. So your expertise, I'm sorry, you want to finish something?
No, that's all.
So your expertise is basically into oncosurgery. It's more of oncosurgery, which is surgeons who are expertised in oncology. Or how you can just make our audience understand what is difference between oncosurgeons and a general surgeon?
That's a very good question. if you think that a general surgeon, to rephrase that, if you think that surgical oncologist is someone, is the general surgery who does cancer surgery, that's not a right concept. Okay. Dealing with cancer, it means that you have to understand the natural history of cancers. This is very specific subspecialization. So in order to understand, let's say, a person, you need to put yourself in that
In their
person's shoes, right?
Right.
So if I talk about, let's say, breast cancer, I have to think like a breast cancer. And that makes, so that's a differentiation between them. So a general surgeon is dealing with, how to say, maybe less acute cases, general cases, from lumps and bumps to hernias, and we know many surgeries like appendectomies, cholecystectomy, means removal of appendix and removal of gallbladder.
More of localized.
Localized, and it's a short-term thing. Now, I can do it on my own, definitely, as a one-man show.
Right.
But when it comes to cancer, then we need more eyes.
Right. We need a
more
team.
We need a team. We need a multidisciplinary approach, multidisciplinary team that involves not just a surgeon who has a knife. We need radiation therapy. We need medical oncologists. We need radiation oncologists, medical oncologists, and all the other disciplines which need. So we need pathologists, histopathologist. It's a team around. And this is the core thing about cancer treatment, that you should have a team with many disciplines.
Yeah. Okay. That's nice to know. So your expertise is into as well, coming to more specific, like breast oncology and thyroid cancers, right? Correct me if I'm wrong, please.
Down the road, I have a long experience dealing with cancer. I was working in this country. I'm talking about UAE.
UAE, more than 2 decades.
That's 13 years out of this was in a cancer center in LA, in Tawam Hospital. And then I joined the private section here, and that's Medcare, where I currently work. You need to see a lot. You need to see more. You need to practice. You say they say the practice makes perfect, right?
Absolutely.
But I don't agree with this sentence. Yeah, perfect practice makes perfect. That's the difference. If you have a target to understand, just repeating things without having a target, without being mentored, without further continuous education, this doesn't make really sense. So you can repeat every day something, but doesn't maybe is going to make us expert.
Absolutely.
So perfect practice.
Absolutely agree, because I saw your list of education and certifications, fellowship. It's huge. I wasn't able to compile it to let our audience know about that as well. But then yes, they can go on your site and have a look as well, since you said you're practicing in Medcare, right? So it's vast, it's huge. That itself says a lot.
Well, if you live long enough, you'll collect this kind of things. It goes without saying. And of
Touch
course,
wood.
Yeah, it's education is a continuous thing. So you can never, at least as a surgeon, I know that it's an everyday challenge. That you learn, you teach, you learn, and you learn,
right,
rather than teaching.
Right.
So, and it's never enough, basically. So it's a continuous tiptoeing.
Absolutely. I have no doubt in that, because I remember the time we connected, it was for a complicated case. I call you for, like, Dr. Godratullah, you're the only one who can, you can do this. And that was an amazing case. I'm not exactly remembering that, but yes, I remember that we got in touch for a complex case, which was like messed up.
Well, that's why we need more eyes. We need more heads into this, and that's why. So if you have a team, dedicated team, things are much easier, definitely.
Absolutely.
And it's not for me, or it's not for those who are involved in a team. It's for the best care for the patient. So that's why it's very important where to go and where to seek help, because practically many times it's just life-saving.
Exactly.
So an unwise, how to say, thought, unwise thinking, unwise how to say, suggestion or opinion can put the patient on the wrong track.
Exactly.
By the time we find out that we are far away from our goals, then it might be late. That's why it's good to have second opinion. It's good to have third opinion, but on the other hand, it's better to go to look for someone who's working with a team.
Absolutely.
So I am a team player. I believe in team, and that there is nothing that can substitute a good team.
Wonderful statement. So since we have just passed Breast Cancer Awareness Month recently, I want to understand what exactly you found as a common cause because of which, any underlying one thing which you found that this is a common issue because of which people are landing more and more into cancer nowadays. I mean, just out of topic, but just to help our audience to get into preventive mode, that this is something you can,
It's a vast topic. I mean, we cannot summarize this in even an hour or so, but just to just touch some main part of this concept. We know about every disease. We say, okay, there are a list of risk factors. Risk factors, in general, of course, we say it either nature or nurture, right?
Right.
Something that it's brought with us. There are factors that we cannot change. This has to do with being familiar or genetic things, okay? These are things that so far we might not be able to do much about it. The only thing we can do is just the prevention or the early detection. But some risk factors, definitely, we can change, right? You want to smoke, drink alcohol, you want to have the lifestyle, you want to be lazy, you don't want to move, and so on. I can go about this kind of thing. So a list of risk factors. When it comes to breast cancer, by the way, just to mention them, the most common risk factor for breast cancer is being a female, because we tend to forget that male people can have breast cancer also. Though it's less than 1%, but the fact is there. So the gender, being female, is there. That's the main thing. And there are some list of things. So there are other lists of risk factors that is in common with other cancers also, and it goes to how we live, how we eat, and so healthy life, balanced diet, activity, physical activity. But these are over there. Okay, we know that these risk factors play a role in cancer formation or development of cancer. But on the other hand, you find some patients that they don't have any of the above.
Underlying, exactly.
Any of the above. But there is one thing that out of my personal experience, that I see that if you put my thoughts together, there is not enough emphasis on the factor which is called stressful life. Stress, it's lethal. Stress can kill. Stress can trigger things. I have few patients, young people, they eat well, they sport well, no family history of cancer, no genetical issue. So we don't have all these factors which you mentioned, but all of a sudden they have a lump in their breast.
Right.
But there is one thing over there, definitely. A stressful life.
Stress. I'm so glad to hear from a surgeon that stress can be a causing factor, a very important one. Right.
And on the other side, I have people who they are exposed to all sort of risk factors, but nothing has happened to them.
Stress-free.
They have omitted. I was talking to a friend of mine actually about 3-4 days ago. Met him in Istanbul. Good friend of mine, and he said he did a complete checkup. I don't know, he's around 60, and he has nothing. But of course, I'm not promoting doing this and that, but I'm saying so that in real life, 2 times 2 is not equal 4, for sure. Biology doesn't work like that. So this friend of mine, thank to God, he said, I have omitted all the risk factor in my life. And here I am. Now, I'm not contradicting myself, okay?
Yeah, I'm trying to
I don't wanna-
understand
no,
exactly.
Just interrupt me anytime you think that I'm not on the right path. But as a person, as a modern person, as today's person, any individual, we have no other way rather than following the science. Why? Because science is evolving. Science has self-criticism. When we say we are wrong, then we change, okay? But there is no other way. So this is we have to weigh how much of benefit we are getting following one concept to one philosophy. So yes, science, I don't believe any other thing, okay? Down in my practice, I've had patients who have lost their chance of treatment because they believed in some, what you call tribal, I don't know, paranatural treatment and this kind of thing, which these are vague things here. And local burning of the area. I had patients who they have burned all the breast because they believe that burning this is tradition is gonna cure them. You know, I wish I could show you some photos, but I can't. So these are
Burning will cure them basically from that. That's what they believe. Strange.
Yeah. It's of course where it comes from. It comes from lack of education. Lack of education. I don't think we dedicate enough time to discuss it with the patients. The health system has gone a little bit wrong in that direction. We don't have enough time for our patient. We don't have time to get to know each other. Today, if I may give an example, I had a patient with a thyroid nodule, something in the thyroid. We came to a conclusion that, okay, she needs surgery, but I told her that we don't do magic. Yeah, I'm not a magician. Nobody's there. But magic is the patient. It's a journey. Any treatment now, especially for those things which are a little bit more chronic, need follow-up, it's a journey. You, hand in hand, you can walk to the target. But if you lose the hand, sometimes for a second, you might not reach the target. But you need trust. You have to earn that trust. You have to value it. You have to respect that. And you have to, stick into it.
And I think most of the times this happens that this not connecting with the patients also leads to a lot of misdiagnosis, right? Where they land into having second opinion or, when you don't understand really the background of what has been the cause and then treating it in that way, isn't it?
Patient is always right, even he or she is not right. That means you give the full authority to the patient.
Absolutely,
but
wonderful.
Providing all the information, patient should know what they're going to happen to them from A to Z. If we know where we're going to start, how we're going to go, what are the possible challenges that we're going to face together, then it's easier. Myself, I like to draw. I love drawing. I draw things. I write it there. But it's important. Now, what's more important for me is that, okay, drawing the lines, talking about the lines, sentences, what is guidelines here and there, they are available there. Overnight, you can go on, internet, go to Google, and then you can have a fellowship overnight.
Right, overnight fellowship, yes.
Something like that. But that's the source of problem also. It's good for the patient to have information, but you have to help the patient to make them understand, analyze this information, how to integrate them, okay, and make sense out of this with all respect, okay? Many times I tell my patients, you know my name? They say no. I say, no, I'm Dr. Google. And I tell them, call me. Anytime you feel like going on Google, don't. You can go, but talk to me. Because
Absolutely.
I see many patients, Googling a lot equals tears.
Googling a lot is equal to tears.
For me, yes. As a patient, how can everyone be
A doctor by
engineer,
going to Google.
doctor, nurse? You know, it can be, and this is the dangerous side of this, that we think we have everything over there. Yeah, but we don't know how to interpret it. Definitely. It's by reading alphabet, we don't know. It doesn't make sense. We need to learn the language. It takes time. And patients need to be taught how to read between the lines. This is what I like to do, and I try. This is my aim, to help them to understand between the lines. Okay. We have guidelines. You can go, boxes here and there, but you have to tailor this individually to every patient. Back to your question, you told me that laparoscopy, for example, is it good for all? No. You should not forget there is another way of surgery. It's called open classic surgery. We tend to forget this kind of thing. So we don't do everything just because we have to do it. So
It's very important because most of the times I've seen people. So this is also a purpose of having this podcast channel, is getting experts and talking about medical stuff, rather than, there are so many non-medicos who are talking about medical stuff online, on internet, everywhere, on all social media platforms, which is creating a bit of unrealistic, I would say, a picture or image of the disease and prevention and so much of stuff. But then coming from the expert is what really matters. You cannot just, anybody can come out and start talking about this is how the disease happens, this is how you can prevent it. But it has to come from the expert. That's what takes you way long in the experience. I mean, that's what makes doctors different, when they talk about something.
I appreciate you raise this one here, because on channels, YouTubes and whatever, you see a lot of people talking, a lot of them, but they are not valuable. And I appreciate that you devote your time for the sake of patient education and talking to experts.
Thank you. And thanks to you, like people like you who are supporting me to fulfill this, this small initiative to help the community getting the right information. And, there's a lot to go. It's a I would say a long journey, which I would, I'm sorry. Yeah, it's a long journey for me.
I think that's the least and last that we can do.
Yeah.
That's educating the patients. Yeah, I think this is, and education is something with a stay, okay? As a surgeon, for example, when I, while teaching residents and interns, we always raise the issue that it's not about doing a surgery. I had seniors who used to tell me, you can teach a monkey how to cut. But what makes you different, to think about what you're doing. Take the patient's hand, and patient ownership. Patient is yours, not like an object. It means that responsibility of taking care. So you should not leave your patient. And it's from A to Z. It's preoperative, with a lot of team involved. Intraoperative, a lot of team people involved, and postoperative. So sometimes there are interventions which are fast, 10 minutes, 15 minutes, half an hour, but you need to work on postoperative care maybe months.
Absolutely.
So it's a package.
It's a package.
You lose one part of it, you might lose all of it. I don't want to do that.
Agree. What are the common issues related to thyroid you come across, Dr. Godratullah, which our audience must know and be aware of, that these are the common issues which we come across, and in any way they can prevent that?
Most of the time, as a surgeon, patients are referred to us. So patients don't come to us really that, okay, we have something protruding out, we have a lump or or something is bothering us, the symptom directly. GP doctors, general practitioners, family medicine, and then on the other side, endocrinologists. It's a very crucial part of our work. And that some of the patients, they have thyroid disorders. Now, thyroid disorders, we talk about non-cancer and cancers.
Right.
But thyroid, as you know, it can work too much. We call it hyperthyroidism. It can be low in function, hypothyroidism. So, and these are treated by non-surgeons unless they become problematic. When the surgeon function comes into the picture is when you have something that is on the way. So we're talking about indication of a surgery.
Right.
But before talking about indication of surgery, most of the time, patient comes, we have a lump in our throat. Now, thyroid, we're talking about thyroid nodules. Maybe more than 50% of population, they have some sort of nodules. But maybe around 10% of them, they will see that, okay, I feel something, or somebody told me, you tell me, Dr. Godrat, you have something over there. I might not realize it. Now, incidental finding is another thing. That you have a neck pain, you do an ultrasound, if there is something there.
Accidental diagnosis.
Eye-catching,
right.
accidental, incidental finding.
Right.
Incidental findings, if they meet the criteria that should be discussed more, to talk to the disease, then they are subjected to what? Biopsies. Okay? In thyroid, usually we have, because we know we have different type of biopsy, fine needle aspiration.
FNAC. Right.
And we have excisional. Thyroid, we're talking about FNAC. Fine needle aspiration.
Cytology.
And that's why. So now, radiologists, when they do imaging, they look at things, okay, this meets the criteria, or it falls under the radar of FNA. Then we do FNA these. Okay. This is so incidental findings. When you do the FNA, then there are different type of results. Sometimes we have to repeat the biopsies. Sometimes we have a definite diagnosis to say, okay, we're going to, let's say, follow this one 6 months, 12 months. These are the usual intervals. But sometimes, okay, we say, okay, the cells, they are not normal, but we don't know what kind of abnormality dealing with this. We call it atypical cells. Then there are, again, it has to be individually tailored, whether to repeat the FNA,
the biopsy,
or whether we go and do a surgery. Now, indication of surgery is one of them that I just mentioned. If you have something that's suspicious, you don't want to keep it there. This is one. So it means diagnosis based on FNA. FNA proves something bad, and we're going to remove it. The other indications is that, so definite cancer, and suspicious of cancer. Sometimes the changes are not cancerous. Simply, we call it compressive symptoms. Compressive symptoms, in medical terminology, I call it 3D. I call it 3D because it's dysphagia, which means difficult and swelling, right? And we have dysphonia, change of voice.
Change of the voice, right?
And we have dyspnea, problem in breathing. So because it compresses, if it compresses your esophagus and you're not able to eat normally, you have difficulty. If it compresses your windpipe or the trachea, then you have breathing issue. And if it presses your nerves, which are responsible for moving a vocal cord, then there might you have to change your voice. It can be dusky or hoarseness. These are the symptoms, and of course, cosmetic issues. Some people have some lump. They say, I'm fine. Ultrasound is fine. My CT is fine. My labs are normal. All these are normal. And we're not going to do anything about it. It doesn't bother me. Let it be.
Right.
So we don't jump on every lump to remove it.
But is there any possibility that it can regress? And in which case is it possible?
I would say in cyst. Thyroid cyst can sometimes regress, even sometimes disappear. But in case they recur, because sometimes what we do is that you have a simple cyst, Okay, we can aspirate it. And sometimes they don't come back, but sometimes they do. And that's more often case. Now, a cyst can be simple, it can be complex. It means I have a solid part and I have a fluid part. And that situation, we use biopsy. We biopsy the solid part and we aspirate the thing on the other side. So we have an idea about these. So it's not black and white, okay? So, but it's diseases of thyroid and back to breast, all of they are pretty much treatable, almost 100%.
Right.
Especially if we
Almost
know things.
100%.
Yeah, because
Wow.
if we know on time,
On
the
time
key
diagnosis.
is on time. How we do on time diagnosis?
Right.
Screening. For some diseases, some cancer, we have a screening. Some we don't have. Okay, we just to be aware of things. But let's say breast. I have so many patients who have been cured 100%.
Early diagnosis.
Early
So coming
diagnosis
to
is
your,
the key.
with the same flow, what are the screening methods by which we can have an early diagnosis on this breast cancer or any breast condition before landing into, a cancer where you land into mastectomy, removing the breast, or maybe it metastasizes and, it spreads.
Well, I'm glad we're talking about breast, though the month is over, but the year is not over, and the next one is going to come. It's going to repeat here. It's something that we are dealing with. As you know, out of 8 or 9 of female, they have a lifetime, and 8 or 9 out of 100, which is about 12%, they have a chance of having breast cancer.
Oh.
That's huge. We're not talking about a life a lady. We're talking about life a daughter, sisters, mother, auntie. That means talking about the health of a society. So can you imagine a healthy society without healthy female? Impossible. So emphasis has been there, is never enough. Never enough. How to get people to understand the value of early detection, that's another thing that we have to master it. There are a lot of talks, a lot of things, but in reality, I don't think we have achieved enough. Occasionally, anytime I have a chance, I'll discuss this. Not just in public all the time, like this opportunity, for which I'm grateful. But so one of my last talk in my hometown was, I'm from Iran, a couple of years ago, and it was I was so glad that I had a talk to only ladies there. We have a big salon, almost 500 people gathered together, only ladies.
500?
Yeah.
Whoa.
And I could talk to them in my mother tongue. That's another thing. So that, you see that the language barrier, it's there. Sometimes it's a real language barrier, and sometimes it's how you communicate with people.
Way of communication.
People understanding are different. You cannot talk to all the patients same language.
Absolutely.
Definitely no. So different kind of patient, different category with different background. So I always ask my patient what you do, or sometimes I say, why you're asking? Like, none of your business.
Yeah, it's none of our business.
You can see that. So really,
It is.
It is our business. It's
Yes.
not my business, So this kind of thing help. People are different. Patients are different. But they are people, I always tell them, listen, bottom line, you have to choose. This is the menu. Sorry to say, it's not that simple, but it's the menu. I tell them these are the things. We say pros and cons, we have to ask them, okay, sign this paper or this one, but it's not about that. If they can sign anything, but if they don't understand, that doesn't mean a lot. Absolutely. That doesn't worth a lot. I take time, and I always suggest the new generation, take time.
Patience. Go slow.
Go slow, absorb them, live with them. Imagine that those individual patients can be They can be your family members.
Absolutely.
Many times repaired. They can be.
People
There
think
are-
nothing will happen in my family. You know, we are all fit and fine. Like how we call healthy lifestyle, still there must be something at the back which might be a factor, a causative factor, right?
I believe me, I have enough patience among my family members and friends' family member to keep me all the time tuned when we think of responsibility. Yeah.
Wow. So coming to the prevention, like what are the ways where we can know that these are the preventive or the screening, to be specific, for breast cancer, and which age people should go for that particular screening to prevent that?
A list of risk factors are there. Okay, as I mentioned, just being female is one of them, but the higher the longer time a female person exposed to effect of estrogen, which is hormonal thing, that the higher chance of having cancer. Okay, but this is not 100%. Never, none of the thing. So we call this that those who are not pregnant, level and null parity, like early menarche, late menopause. So it extends the time that you're exposed to hormonal effect, estrogen. This is another factor. There are some, alcohol, smoking, aging itself, all this. But the list of risk factors can be found anywhere. But what's important is that how to have a balanced life. I've read so many books about, these are the diets you have, you won't have cancer. These are the things you do, cancer. That's not true. There is one thing that can help everyone. Being healthy or having a balanced life is seesawing on your own. How can you do that? You go on this side, that one goes up. You go the other way around. So you have to do the seesaw. It's a must. So you have to stay in the middle, a little bit here or there. So everything. I think if you take an average of everything, you're never going to harm. There is a chance that you're going to harm yourself. It's almost zero. But you can't avoid. Have you heard they say, zero fat? Such a concept for me doesn't exist. Today, the air has fat.
Yeah, true.
Really? With zero fat, it doesn't. Zero sugar? Oh, come on. There's sugar in the smiles. Also, you know what I'm saying?
Wow.
So you can't avoid this kind of thing. But I say, low fat, low sugar, minimal. Next to that one, exercise, moving a lot, avoiding what you call sedentary lifestyle. These are the key factors. And if we're forgetting something, right? Stress,
yes, right.
And that's something that isn't never been emphasized enough.
Absolutely.
I believe in that. Okay, I think I still believe in how to say this patient-doctor relationship, which we are getting away from that. The modern life, the new thing, I don't know, this AI, all these are being taken away from
connectivity.
us. Okay, so it's a big confusion, I think, and it helps. Everything, new things, modern things, I'm not against it. Definitely, that's absolutely nice. Okay, but can it think instead of us? No. Do the AI know me, or do AI knows who is Anita? Absolutely no. This is going to be way. I think this is going to go on. This from certain aspect, this confusion, this chaos is going to grow. By that time, thankfully, I'm not there.
Oh, don't say that. No. You know, this is also a reason. I mean, I'm so obliged being a podcast where a surgeon, an onco surgeon is talking, and we are talking on so much of basics of life by which we can prevent landing into a situation where you go for a surgery. this is the core, and this is also a reason because of which I know you, and I wanted you to be there. Like, we know we don't talk much about ectomies, removing surgeries, removing this, removing that, but what is the core of everybody's suffering? I mean, healthcare. Where is health? What healthcare is? Maintaining health is healthcare, but it's more of becoming curing the disease. So it should be disease care. What is healthcare? Healthcare is like maintaining health. We are losing that aspect in healthcare industry. I feel.
It's prevention and maintenance of health. Absolutely. These are the things. One of my friends once told me, I said, "Oh, I'm watching this ER." That was long back, ER, the TV series. That was like all doctors and emergency room. I said, "I've been watching this for last 20 minutes. I don't understand a single word." Yeah, even some of these series are for doctors. You get my point?
Yes.
It's good, educational, but you cannot read Shakespeare with all respect to a child. You have to let it grow. You have to help him grow, make him understand the language, concept, philosophy. Then say, okay, that's so we don't. Not everything is in its right place. That's what I'm saying. That's what I'm saying. But all in all, you might think, okay, what's good about being a surgeon? Being a surgeon is not a task, it's not a job. For me, it's a way of living. Okay? You will be a surgeon everywhere. When it comes to solve an issue right away, you have to, because it's a matter of life and things. If I can't do it right away, I'll ask someone. So it shapes your personality. And it's continuous everyday challenges. So it makes you tough. You have to be tough. Life is tough. So, but at the same time, it keeps you modest. It keeps you modest. Otherwise, it's like, I think surgery, like many other things, is like an art. You have to appreciate that. And it's never about individuals, never about a surgeon. No, it's the concept of health, disease, treatment, cure, and all is targeted about the patient. That's our responsibility. Definitely patients have some responsibility also, but that's subject to another talk or
Another
something.
talk.
That's
Yes,
a different.
we will have it. We will have it for sure.
Now, if you look at me, definitely you say, "Oh, okay, we talk about a lot of things. We're not talking about science." That kind of thing. But to me, science are written everywhere. But between the lines, what I feel that's missing, it's not written anywhere. Okay, so I'm looking for that. I sit with my friends, my mentors, and I'm always obliged and thankful for what they have taught me. Many of my great professors, what I remember from them is just one sentence. To give you an example, I studied in Hungary, the University of Pécs, Medical University of Pécs, with great, strong background, 100 years. And we had a professor of anatomy, neuroanatomy. His name was Flerko Bela. He was asked once that if you do your life again, would you do anatomy? Will you be a professor in anatomy? He's the author of chapters in Gray Anatomy, and he's a big name. And I had the chance to learn from him. And he said, I would do anatomy, but not anatomy of the body. I'll do anatomy of the soul. That's the professor who taught me anatomy of the skin, but this is what's important for me from him, because that's inspiring.
Right.
That's the fuel, that's the energy you need to go on.
Absolutely.
That's it.
Wonderful. Beautiful. I'm in another world now. It's beautiful, really. So, Dr. Godratullah, as a mentor, what would you suggest interns or resident doctors who are coming up with that one key thing with which they can connect with patients? Since we are talking more about connectivity and understanding the patients, what is that one thing you would advise?
Dedication.
Strong word.
There's no other way.
I mean,
There is no other way. There is no other word. Dedication.
wow.
You have to love your patients.
Understanding the soul.
How can you help without having a tinge of love?
I mean, in the world of advancement and AI, people have become more structural, practical, superficial rather than understanding the core and the cause which is coming from the bottom. As you said that I would like to be, like the master said, I would like to be the master of soul rather than the anatomy. I think this is also a reason because of which stress is becoming most and most important factor of most of the pathology and disease what is happening in today's time. Instead of all the risk factors being in place, avoided, whatever, but stress. And then loss of connectivity is one of the factor because of which the stress is increasing.
I think as life is getting tougher everywhere, the chance of living healthy is taken away from people. And I might not, I shouldn't say this maybe, but I say, but things are being more economical or money centered. And when we look at the health as a service, I don't understand this combination word health service. As doctors, we should have enough support to be able to devote our time for our patients, to practice that love that I was talking about. And as patients, people should have the safe environment and backup to live normally. As a both sides, things are missing from both sides. Actually, the way we are going, this poisoned, sick environment is going in a wronger direction, more and more, definitely. There is always solution, definitely. There is always hope. And I think we cannot change the world.
But if we have people like you, we need more and more people like you to get into that path. Otherwise, it's very difficult. World is getting so much economical. So much economical. This one basic element is missing, right? You see, health insurance, health, where do they cover basic preventive medicine? When you get disease, they cover it, right? Surgery is covered. This treatment is covered. Where is the preventive medicine in any health insurance? How much percentage is that? I'm just adding to your, it's my feeling as well.
No, that's it. But you're getting a little bit political now. Okay, you might just step some circles.
I hope we don't get banned soon.
Definitely. So I think we can't change the world, but within circle we can grab each other's hand and make it better for ourselves. We can't change the world. Definitely, it's a tendency over here. You think how frustrating is that when I have to teach medicine to an insurance agent, to getting acceptance, to teach medicine over 4 or 5 lines without, over an email to understand them. I give an example. I'll put it. We know very simple. A simple example. We say how gross is this? Everybody knows what is a lipoma, as a fat lump. Now, lipoma doesn't have any conservative treatment. Everybody knows.
Absolutely.
If it comes, you have to get rid of it.
Right.
You have to remove it, okay?
Right.
Now, you have to get approval, okay? Patient comes and sends the approval and said, okay, the question is, what kind of conservative treatment has been used so far? I don't know how to, on which wall I have to bang my head, and sometimes I said, excuse me, please call me. I don't have time. And you spend sometimes 3-4 hours negotiating with them. And then I say, I'm sorry, I can't teach you medicine online. So, but that's the problem. Now, I can't solve it. Hospital cannot solve it. This should come from government. This should come from centers. That to make it easier. I know there's the other side of the coin. Some people might abuse the system if they agree for everything. But if they know, okay, there is a name, okay, it's Dr. Anita, we know her for, I don't know, whatever, we give value to this and we trust. We monitor them. So if something wrong, then you deal with it. But you don't assume from the beginning that you're up to no good.
And you make everyone suffer.
Yeah.
If patient suffering, doctor suffering, right? It's so important.
I'll tell this story if you want to share it or not. Because sometimes some people get something called lymphadenopathy and large lymph node, okay? And this is a conservative treatment. And then they say, okay, this is not going, we're giving antibiotic, it's not getting smaller, it's not disappearing. So, okay, let's take a bite of it, get a biopsy, and see what's happening.
What's happening inside, right?
For a patient, I applied for insurance. It took more than 2 weeks until I could convince maybe it's something wrong with me, but I'm not that bad in negotiating. But it took more than 2 weeks. And the patient was brought to operation room. And then we re-examined patients again, right? So when I examined the patient, I see there is no lump. Yeah, by that time, antibiotic has affected, maybe longer time. So, and I told the patient, listen, I'm not going to operate on you. This was not easy. It happens a couple of times. So you cancel the operation because you have committed yourself. No, we're treating this patient, the responsibility. So, and I told the patient, I'm very glad that I don't have to operate on you. But I had to explain to insurance, why you're not operating. You have taken our time, you have taken this and this and that. But this is a bizarre word, right?
Oh my goodness.
So you see that? Is it how
so
gross
because
is
we
that?
have given approval, you cut the patient and you remove whatever is there in the neck, even if the lymph is not there. Oh my goodness.
Because they don't live with the patient, they don't see the patient. And so many people we are dealing with, they are not expert over there. Why? Because they go Google it. It's like if we have a lipoma or something and Google this information, they raise issue. Their job is not to agree, unfortunately. But I think this, when it comes to insurance, I'm not expert in that one, but in the field, we feel what are the problems and things. And one more thing that is grabbing the healthcare system neck is that they don't talk to people who are there in the field, okay? We know what's going on over there.
We know, yeah, exactly.
Okay, sometimes we say, okay, 2:15, one patient, you see 2:30, another patient. But sometimes within 15 minutes, I can see one patient. Sometimes I need 40 minutes. Sometimes I need. Today I had a patient, I spent 30-something minutes, definitely. I felt that and I said, and I told outside, please tell the patient because it'll be a bit longer.
A person like me will take 1 hour of you. I'm just saying, I mean, that connectivity again.
If it's needed.
Yes, we have to.
It's not about just patient, about myself also. If you take time, you explain, then it's easier all the way. Because this is the road we go together, right? So you're not going to stop me every 2 minutes. Where are we going? What are we going to do? So from A to Z. And sometimes, of course, recalling things is a must. When we do that, it's not easy. It's a challenge, but it's a joy at the same time. That's life. I mean,
that's life. Yeah. So, Dr. Godratullah, ending our conversation with, we had an amazing conversation today, but it has to end somewhere. I mean, I wish we keep talking the whole day about it. But what is that one thing you would advise people in today's time that they can do this to stay healthy, mentally, physically? That one thing.
It's really a hard question. There is no such a thing at one thing. I think having a balanced life, takes a lot of things. It's not just patient. Let's talk about a family. I think you have to educate a family when you're talking about people, sick or non-sick. Okay, you might, if you are in a supportive environment in a family that they understand you, you can do whatever you want, right? But for example, you're the doctor, you tell me, oh, from now on you have to be on low fat, and the family will not understand. Okay, so we cannot cook for you separately. I'm just simple. I'm simplifying. It's too easy thing, So I think there are enough information, enough of things, but too many things. You can't follow all these guidelines. You can't. People have written so many books to the extent sometimes I think, do we need to write book? I think today our brain has evolved to the things that we don't need.
We don't need that.
We don't need this thing, maybe. Okay. And this is, I can take it to a religious aspect sometimes. Okay. They say, okay, why we don't have any more new prophets? Because God believes that the human brain has suffered enough, prophets have suffered enough to help, let's say, to evolve this to the extent that they can distinguish from a well from a way. We say, okay,
Yeah.
I think, but this gives a responsibility, and we are responsible for ourselves and for the others. On our own, we are nothing. Together, we are everything.
We are everything. Wow. So a balanced lifestyle. I'm sorry, my question was vague, but I wanted this thing to come out from you because, I just don't want straight questions and straight answers. There is a lot of thing along and, in front and back of that question, which I wanted you to talk about, and there you go.
One thing we didn't talk about, it's about our immune system. Immune system is the trigger and the brake at the same time. So how are we gonna except when somebody is born with some autoimmune disease, whatever, but the immune system, immunity can be levered, elevated, pumped up, improve. How? You need mental health.
Mental health. Very important.
Mental health. And that's it. And that's the motivator of thing, when you lose your immunity. But if you're not okay, nothing is okay. Sometimes I've seen people, they are not in mood, they are whatever. You talk to them 2 minutes, you give them some idea, so I'm into it.
Yeah.
From 1 second to the others.
Right.
So mental
health is very important.
Very important.
If in place, we can really come out of disease as well. If you are in place and balance. I think in today's time, people take mentally being strong also in some other way, that they try to be rigid on themselves. And I think that should not be the way. Understanding what exactly is mental health and having a balanced life to keep yourself at that mental peace is what is the core of being healthy.
Simplicity, thinking simple, being simple, living simple, loving simple. Simplicity is the key, to mental health.
Thank you so much, Dr. Godratullah. Thank you.
I do appreciate this opportunity. Really, really, that was, I like such talking. I'm not talking about media. If you talk to a friend, it's just like talking to a psychologist.
Yes.
Because you think, why are you talking, what you're thinking, this is how you organize your thoughts.
Absolutely.
Okay?
Absolutely.
And I do appreciate this.
Pleasure, really.
Wish you luck, and this is great what you're doing. I wish you all the best.
Thank you so much.
God bless you.
Thank you so much, Dr. Godratullah. Thank you so much for coming. Thank you. Thank you.
Med Talks by Dr. Anitha, making medicine more human.